Okay, so this is your post-operative knee setup. You have your bandages on and your brace on, which we'll send you home with as soon as you wake up from surgery. This is what your knee's gonna look like. The brace will typically be locked so that the knee can't move, and that's done on purpose to kind of let things calm down. So you're not bending too much, not hurting too much, but follow the directions depending on which surgery you have. We'll have different directions on when this needs to be locked. Typically, this is going to be locked when you're walking initially after surgery. It's also going to be locked at night to help keep your knee straight so that you're not bent all night long and then having difficulty during the day getting it straight again. So when you take your dressings off, it'll be on day 3. You just pop these open. Have your knee on something nice and stable. Typically that's going to be, the couch or the floor. You probably need some help with a friend or loved one, but this will come off. All the bandages will come off. Whatever incisions there are, you can replace them with simple Band-Aids or keep them covered. You may want to also put the ACE back on if there's still some swelling. But when you readjust the brace, because now that the bandage is off, your brace is going to be very loose. And so what you'll want to do, and if you'll hold the wheels there, is get all the brace. The brace needs to fit well. And so we'll adjust all the different Velcros. Get it fitting again. And there's four different brackets, but you need to make sure that you adjust it by opening up the Velcro on this, tightening it, clipping it, and then adjusting it through here. So now this is going to be too long. We'll remove the Velcro and then we'll fold this down. You can cut this if you want. I think it's better to fold it over so that if you need to adjust it in the future, sometimes you cut it too short accidentally. And just go through each one of these. Make the adjustments as necessary. It's a little bit of a hassle because of the Velcro and the multiple adjustment sites. But once you get it adjusted and it fits better, you're going to be a lot more comfortable. Okay, and then again, just make sure that you're knowing where the wheel needs to be. This is the locked position for ambulating and for sleeping. And then when you're ready to work on your range of motion, this brace has been set that it'll go from -10 to 90 degrees. And so we'll just unlock it and then allow the knee to bend. And then the brace is gonna stop her right at 90 degrees, which is all we want for her to do to protect the meniscus repair or whatever surgery she had. So regarding the range of motion, we're going to set the brace up for you after surgery so that when you wake up, the correct range of motion will be allowed. But that should also be written down in your post-operative instructions. You can talk to your physical therapist as well if you're doing therapy and make sure that the range of motion is set where it needs to be based off the procedure that you had.